Hey everybody, today we're going to do a little bit of a hands-on with some cervical vertebrae and a little bit I'll be your tour guide for today. So what we're going to do is I just want to show you a little bit about how this thing's put together, why it's structured that way, and how it's actually moving. So we have two types of motion we're going to go through today. We're going to be talking about rotation of the joint, and we're going to be talking about that axis of rotation of the joint. So which way is that joint moving? What is its axis of rotation? This is really important for us to figure out, because that's going to determine what coupled motion actually is. The other thing we're going to be talking about is translation. So the joint actually moves and translates. So there's a difference between a rotational motion, which is going to have sort of a center of rotation, so it's going to be pivoting around its axis of rotation, versus a translation, which is more of a straight line kind of vector motion. Sometimes the translation will have a bit of an arc to it, okay? However, it is basically a very different type of motion, and we need to understand what it is that we're looking at when we're palpating the spine, whether we're looking at rotation or translation, and where those problems are when we're palpating as well, because we would do something very different for a rotational issue than we would for a translational issue. So we're just going to look first at the surfaces of the joint, just to kind of get to know a little bit about how this thing's constructed, and then we can start to figure out a little bit about how it moves. So this is a C5 here. I'm going to put my fingers on the end plates of C5, and if we look, assume that this would be sort of a horizontal, sorry about the focus here, assume this is sort of a horizontal for the moment, just for the sake of comparison, you can see the angle of a facet joint is quite a different angle than the end plates. So when we put the joints together, it doesn't make sense that rotation would be happening through an axis sort of in line with my finger here. Like this used to have a little pole in it, and we were all taught in school with our spines that this is sort of the axis of the spine, but it really and truly isn't, because if we were to try to rotate about this axis, we'd be jamming one facet into the other, and that wouldn't be a good thing. It's not really designed to do that. It's meant to slide. We all know that. Now, we have a facet on either side, or a zygapophyseal joint, however you want to call it, and they can move in two types of ways. One is that one facet will move upwards as the other one moves down. Okay, so you have sort of a motion like this, and that's what we call coupled motion. So that coupled motion is left rotation and left lateral flexion. If you look at it this way, you can see how it's laterally flexing to the left, and right rotation, right lateral flexion. That's normal coupled motion, but I'm just going to call that rotation because there's no other way it can do anything else. If you're just forcing rotation based on an axis, which is here, you're going to be jamming the joint together. And very often that's what we're doing. If we're doing a sort of rotary brake, what we're doing is you're going to be taking the joint, and say for instance you might take the joint, rotate it to the left, laterally flex it to the right, and then give it another big dose of rotation. What you're going to be doing is laterally flexing this way, and then this side's going to be pressing, you're going to be pressing the facet joint together here, and then gapping it on this side. So the joint clearly isn't meant to do that. And I want to show you just quickly, if we do that, if I rotate it to the C5 to the left, and then I try to, so I sort of jam this right facet together, and then I try to gap this one, just look at that space where your spinal cord is. That doesn't really look like a great thing to be doing. And I'm not saying we're causing any spinal cord damage, but it doesn't make sense that it would move that way. The bones dictate a different type of motion. Now, the first thing I want to show you about this type of rotation is where that axis of rotation is. Again, we're sort of intuitively thinking the axis is here, but you can see that very obviously it can't be there. The axis of rotation is actually centered around the spinal canal, and it's on an angle 90 degrees to the facet joints. So if we put the facets like this, and we go 90 degrees to that, this is your axis of rotation and the center of rotation of your cervical spine. So we could actually put a pin through it this way and rotate it, and that's going to show us where that axis of rotation is. Okay, it's a little bit hard, there's no disc here, I've taken that out, but basically if we were to rotate it that way, it's rotating around this axis of rotation. Now, I'm going to show you something else. Now, just see how this is a coupled motion, and just look at that space where in the spinal canal, it's staying really, really nice and open. Okay, it's happy to do this. This is exactly how that joint is meant to rotate. So this is the first motion, and this obviously involves quite a complex interaction of the muscles around the joint to be able to manage the integrity of the joint by stabilizing or shunt muscles, and also the contraction of sprint muscles, which are going to move that joint and perhaps even several segments. So this is quite an interactive function to be able to control that. So there's muscles all around that are very responsible for that. Now, one of the things that will happen is very often we're palpating the spine and we see that there's one motion that doesn't work very well. And just to start very simply, what we could say is that if there's muscles on one side that are tighter than what they should be, what that's going to do is shift the axis of rotation towards where the tension is. So if there's tension here, that would be limiting movement away from that area and creating a shift of the axis of rotation towards the tension, and then the joint will take on an aberrant motion. And this is what we call path mechanics. So path mechanics isn't a great thing. Now, keep that in mind because we're going to be talking about that again in a second. But first, what I want to show you, or the second thing I rather want to show you, is the other type of motion of the cervical spine, which is a translation. So it's this glide here. So in the first example, we're talking about one facet going up as the other side would go down. Now in any spinal joint, if you do this little trick, you're going to figure out what coupled motion is. People are always asking, what's the coupled motion of the upper cervicals? What's the coupled motion of the lumbars? Just do this. Do this on your spine and you'll be able to see very clearly. Take one facet, move it down, the other time move the other one up. And this is the coupled motion of the neck. And it's very similar to the coupled motion of the lumbar spine, despite all of the arguments. But there's a lot of variability in here in terms of what's happening in different parts of the spine. And there's also a lot of room for other types of motions as well. So it's not super hard in stone, but basically the way I like to look at it is coupled motion is one side going down, the other side going up. That is a rotational motion that's happening at an angle, 90 degrees to the facet joint, with the center of with the axis of rotation basically in that spinal canal between the two bones. Okay, that's really where that point is going through like this, and that's where your axis of rotation is, which is going to allow that to function. Okay, it makes sense. There's a little bit of variability depending on the actual angle of those facets, whether that point of rotation is more forward or more back, or whether it's sort of a dish shaped. But that's just the general idea of it. I want to get you out of the idea of thinking that the axis of rotation is right here, because it absolutely isn't. Just think 90 degrees to the facet joint. That's your easy, quick answer. Now, if both facet joints are doing the same thing at the same time, so they're both sliding up or sliding down, that is a translational motion. That's a straight line motion. Yes, there is a little bit of an arc to this depending on the shape of the facet joint. It can kind of roll forward like this a little bit as well. So if you say, is there an axis of rotation here? Yes, there would be. It'd be kind of in the lower body, the body of the lower vertebrae. It would be rotating a little bit like this. But I don't consider that rotation. And I think there's a good reason to separate rotation from translation. And we'll get to that when we get into more complex things. But for the sake of simplicity, let's look at this as a straight line function. So translation is a straight line function where both facet joints do the same thing at the same time. You can see that what we're doing here is moving the joint into flexion and extension. If you look at it from the side, this is flexion, okay? This is extension. That's a translational motion, okay? Boom, like this. That's how we get flexion and extension, which again is different than lateral flexion. Lateral flexion involves this rotation. Now, one of the other things that people don't very often think about is that not only can you translate this way, but you can also translate at angles like this. And the spine is really, really happy to translate up and to the left and down and to the right, up and to the right and down and to the left. So what our motion of our spine is actually doing is actually a little bit more like a figure of eight motion like this. So there is a rotational component and a translational component, and a rotational component and a translational component. And when this whole thing is happening, you can see that that space of the spinal canal is not being affected in any negative way whatsoever. Your spine is very, very happy to do all these motions. So this motion here, this translation, is really not any compromise of that spinal canal. Okay, no changes in it. So this is truly how we're meant to work. We do translate like this, and this is the motion that we're really focusing a lot on in adjusting to neutral. So that's really what we're going to be looking at. Now, remember we were saying at the beginning how sometimes there'll be tension in one muscle, which is limiting or changing the axis of rotation of the joint. So we see some joint which is moving in kind of a pathomechanical way. It's not moving quite the way that it should. It's moving in kind of a sort of a weird way. Maybe it's taking on more flexion rather than rotation. So the other thing to think about in that sense is that really what's happening is there's probably one muscle that would be causing that. Now, if we were to try to use a rotational adjustment to try to stretch that, you would say, well, how do we stretch this muscle in between these two joints to try to release that? What we might do is take the joint off in this direction and get a big rotation in there and try to stretch that through a rotational adjustment. Now, you can do that in a coupled way, and that works, absolutely. I've done 20 plus years of coupled adjusting. That definitely works, okay? However, what you end up doing is actually affecting a lot of other muscles around the joints as well. So you might not want to be stretching lots of muscles. If there were a way to affect just that one muscle, which is too tight, effectively, then that seems like a better approach. And indeed, that's what adjusting to neutral is all about. In the palpation videos, I'm not going to go into it today, you'll be able to see where there's tension and say in this example that there's left anterior tension. What will happen is when the joint gets tight over there, what it will do is it may rotate, but what it's going to do is it's actually going to shift the joint into left anterior position like this, and the joint below it is going to be sticking out like that. So in other words, what you're going to find is this tension over here is going to hold the joint. Let me just show you a few different positions. It's going to hold the joint like this in flexion, okay, and flexed and to the left like that, okay. But what's going to be happening is the joint will be like this. So what the translation that it isn't doing when it's like that is this translation. So imagine the 5, C6. C6 can't slide underneath C5, okay, because there's muscle tension here, left anterior, that's restricting this glide from a left anterior to sort of you could say right posterior, but we're not really pushing it that far. We're just taking it from left anterior back to a neutral position. This is the restrictions that we're finding. So when I'm talking about adjusting, what we're talking about is taking the joint from wherever it is and whatever muscle tension it is, and we're using a vector of force. Now, a vector is just going to be affecting this much more so than other muscles. A rotation is going to affect everything all around it, whereas a vector is going to be much more precise, particularly with this translational, this sort of glide at resolving that muscle tension. So in the adjustments, I'm just going to give you a quick little insight. So what we're doing is if we find that there's left anterior tension, we're going to put the head in a position where we're going to hold the joint with 2 fingers. So the left side, hold C5 with these 2 fingers. Remember the joint's like this. And then what we're going to do is hold the head in rotation, just so we can have a good grip on it. The joint is actually left anterior. So when it's left, it's also going to be laterally flexed to the left as well. So what you really need to do is get that joint and press upwards. So you're going to be pressing upwards to help it go into where that tension is. So in other words, if it's tight and pulling it left anterior, you let it go left anterior. Okay, so that's going to involve some left lateral flexion and left rotation. Okay, but comparatively, C6 is posterior and to the right. So what we're going to do is come in with our thumb contact, and what we're going to do is come in with thumb contact like that, and we're going to drive C6 towards midline. Okay, so we're actually going to make the joint, take it into this position, which is a coupled motion. So C5 left rotated and left laterally flexed is a coupled motion. So we're taking it from that coupled motion. We're not changing rotation in the adjustment, okay? And we're not changing lateral flexion per se. We're just coming in here. We're going to drive this with a glide back towards the midline. So you're holding C5 with one hand, and your thumb's on the lamina of C6. You're going to bring that joint right up into lateral flexion, and you're going to drive it straight towards the midline. And what that will do is that will bring that joint back this way. That's a very, very powerful way of releasing this tension. And then once this tension is released, what happens to the rotation? Well, this muscle isn't tight changing the axis of rotation. So when you reset the gain of this muscle, the axis of rotation can shift back towards its normal position, and your rotational restriction or your pathomechanical rotation has been resolved. So it's a very, very, very precise, but very, very common sense way of resolving that, because we can get to it much better with a vector, and we're using this translational, this glide. I mean, you can see that even if I see if I can zoom in here, you can see the huge amount of motion that's available in here for this translation that goes at different angles. The joint's really, really happy to move this way, and it does, but we're just not really tuned in our minds to palpate and to be able to discern exactly where those issues are. Now, what I will say is, just as a hint, most of the issues are going to be left anterior or right anterior, so you're going to be pretty much taking them in the same position, get this joint back here, and you're going to drive it underneath so that they line up. So boom, this is a neutral position. Yes, the joint is rotated, it's laterally flexed, but you're taking it from this position back towards a neutral position. The whole neck is rotated to the left, and there's maybe a little bit of rotation here and a little bit of lateral, and there's lateral flexion, but that's not changing through the adjustment. So that is a static point. It's like a set point. You set that rotation, you set that lateral flexion, and then you drive this. So the only motion that's happening is that translation. Okay, so that's why we're adjusting to neutral. It's taking it from here and boom back towards a neutral position. So that's the basis of what we're doing here. So I really appreciate you guys watching this. I'm glad everyone's interested in learning. I mean, it's taken me a long time to figure this out, but for sure, I found lots and lots of resources. If anyone has any questions about where all this information comes from, I can certainly point you in the right direction. But that's basically how the joint works. Those are the most common problems. I feel very strongly, and I'll give you other videos to substantiate why, a vector-based adjustment is going to be much more important and practical and a more direct way of resolving rotational problems as well. So I will always do this first. And if there are indeed rotational issues, I mean, you have degeneration, all kinds of other things as well to look at, but there are different ways that you can resolve other little tiny details in rotational restrictions, and some of those are tissue issues as well. But there's definitely some good techniques for that, and I can get to that later on. But I'd really love everyone to be able to master this. It's pretty simple adjustment. Look at the other videos that are up on the page, and if you have any questions, please do get in touch. I certainly welcome you all to put your questions and your insights and your discoveries on the page as much as possible. But if you feel you'd rather talk to me personally, then by all means, contact me with a personal message, or if you want to have a time to sit down and chat, I'm really happy to do that. I do that with lots of people. I'm training people right now, so I'm fairly well versed at how to explain all this stuff, whether it's on video or in person. So please do take advantage of everything that's on the page, and also please let me know what other things you'd like to see. I can go into way more detail in any of this stuff. This is just a quick introduction into the way this joint is built, the way it functions, and getting people looking at the translational function, which, I mean, I certainly wasn't taught this in school. There are some techniques. I mean, Snags pays attention to translation. The cervical stair stepping that tries to do stuff with the translation as well. There's a few other techniques that do things with translation, but it's certainly not used in the high velocity sense. And that's where I feel that we could definitely get the most benefit out of this. So again, thanks to everyone for watching. Drop those comments in, and let's get started adjusting. Okay, tell me how you guys are doing, and thanks for your patience. Thanks for watching.